Okay, so we're going to start. Good day, everyone. Hello. Welcome to this exclusive webinar with Governor Ridwan Kamil, our COVID-19 story, West Java, challenges, wins, collaborations, opportunities. I'm Asti, Events Coordinator at BritCham Indonesia. This webinar is proudly organized by BritCham Indonesia in collaboration with our foreign chamber colleagues. And before we start, allow me to review the functionality of this Zoom webinar. Kindly be informed that today's webinar is being recorded and we will be able to share a link with you when it's available after the event is complete. All dial-in participants will be muted to avoid background noises that may distract you from listening to the webinar, and also to enable our speaker to present without interruption. We have also activated the Q&A box located at the bottom center of your screen. So if you have any questions, please type them into the box at any time. Okay, now without further ado, I'm going to hand the screen over to Ridwan, the Executive Director of BritCham Indonesia, who is going to start today's webinar. Chris, screen is yours.
Thank you very much, Asti. Good afternoon, Governor Ridwan Kamil, and thank you for sharing your time with us today. Not just ourselves, but all our chamber and business group network. On this occasion, it's been a pleasure for BritCham to have coordinated a collaboration of 20 foreign chambers and business groups. On this webinar today are more than 400 senior corporate representatives of AmCham, OsminCham, DanCham, Dutch Business Network, EuroCham, Econit, IABC, ICCC, IFCCI, Norway Business Council, Italian Business Association, JETRO, Jakarta Japan Club, the Korean Chamber, the Nordic Chamber, Philippine Business Group, Singapore Chamber, Swiss Chamber, and USABC. I would sincerely like to thank all colleagues of these chambers and business groups. Numerous advanced questions have been received, so I need to say apologies in advance. It will not be possible to pose all of them. Some will be addressed during the Governor's presentation, and others will be bundled into conversation later on. A relevant section of interactive questions will be squeezed into the limited Q&A time that we have, and the Governor will receive a full list of all the questions that have been submitted to us. I would now like to hand over the baton to the BritCham Chairman, Ainsley Mann.
Thank you, Chris. Welcome, Governor. Welcome, everyone else. It's my great pleasure to welcome Governor Ridwan Kamil to this very special webinar. The Governor has long been a very good friend of the international business community in Indonesia. And this is an important time for everyone, so we're very grateful for the Governor to spend an hour or so with us today. I believe this is about the 8th year the Governor has been in public service. He became Governor in 2018, and prior to that he was the Mayor of Bandung from 2013 to 2018. He is by training an architect, having graduated from Institute of Technology Bandung, and then went on to the University of Berkeley, where he had a master's in urban design. He has worked in the US, he has worked in Hong Kong, and then came back to Indonesia, where he established his own architectural practice, which has won numerous awards, including, but not limited to, the British Council's International Design Entrepreneur of the Year Award. About a year ago, I was just talking before the Governor came on, the Governor and I were in the UK, and about this time we were speaking to some students in Edinburgh, and at that point in time the Governor announced he had about 10 million followers on social media. I've just checked this morning and he's now got over 16 million, so that's not a bad growth rate in the last year. West Java has a population of around about 50 million, which if it was a country would be about the 30th largest country in the world, larger than Spain, and putting it on a par with the likes of Colombia and South Korea. So clearly it's an immense challenge to manage a province of that size, and particularly at a time like this. So without any further ado, what I would like to do is invite the Governor to give us an update on the COVID-19 situation in West Java, what's the action that's been taken so far and how he sees things progressing in the future. So Pak Ridwan, I would very much like to hand over to yourself.
Okay, thank you, Ansley, Chris, for the introductions. And also, I would like to say thank you for the opportunity. My greetings to all the participants in this webinar. I hope all is well for all of you. And I would like to share to you from our first-hand perspective. First is about the fighting COVID. Second, to inform you the economic stimulus that the central government and all of us would like to inform you. Let me start by sharing, of course, the slide. But before we start the slide, I would like to say this COVID pandemic hits everybody from all economic level. It's every nation from all levels, from developing country to developed countries. And I don't think there is one strategy that can be used for all the situations, given the social culture of each people of our nation is very different. So my approach would be try to find the best recipe for West Java people, but also try to comply first to the central government guideline and also to the direction from WHO guidelines. I start with the slide of the data. I think coba data global. I think per today, if I'm not mistaken, the whole confirmed cases in the whole world more or less around 4.5 million, with the dates number around 300,000 more deaths. Yeah, and in Indonesia itself, as per today, is around 17,000, and the rate of recovery is almost 4 times. In this case, I still believe the actual number is higher because it's depend on our capacity of testing. Yeah, but I will give you the overview within our testing capacity, what is the good news and bad news, and what's the challenge we have to face in the coming weeks. Next. Just to give you the size of how many lives I have to save, my responsibility is the same with the president of South Korea. We have to save 50 million people, but I have only 1% budget and resources compared to that in South Korea. So you can imagine with only 1% fiscal capacity, I have to deliver the safety of the same 50 million people. So the challenge is very, very high, and I have to do all my best creativity and leadership thinking how to solve this one. So I started with the 5 values of my approach. I have 5 values that we are doing in West Java. Number 1 is a proactive approach. Why this is important? Because as a leader in West Java, I cannot wait 100% waiting for the direction from central government. Yeah, but 1 month before Pak Jokowi announced the first case in West Java, we already state the highest alert for COVID. Yeah, I was criticized to announce that highest alert because they said it might create the panic, but for me this is very important. That's 1 month before the first case announced by Pak Jokowi. Another things in the proactive approach, by the time the central government centralized all the PCR tests, West Java was the first province to test it using our own lab. We bought the PCR directly to South Korea with our own decision, our money. So this is what we call the proactive, because time is really critical, and as a leader, I cannot really rely on something that I cannot control. Yeah, so this is one of the things. And I have to say to you, our testing capacity now increased from 140 sample a day, very small first day, now to 2,100 sample a day. Before only 1 lab location, now we dispersed to 9 lab location already active. In total, we can test around 2,000 sample of PCR a day. Yeah. Second value that we are exercising in West Java, and this is very important, is what we call scientific leadership. Yeah, I never make any decision without any support of data. I try to reduce my decision-making process based on feeling or emotions. Yeah, so we always take a data as a base for decision. Good data, good decision. Bad data, bad decision. For example, why partial lockdown happened to be in Bogor, Depok, Bekasi? Because the data show that the first couple of weeks, COVID mostly happened in Jabodetabek. So my decision to make first partial lockdown or PSBB was in the Jabodetabek. Second, in Bandung Raya, because the data show 70% COVID circulated in Bodebek and Bandung Raya. And why we make it partial lockdown for the whole province the last 2 weeks? Because the data shows the speed of COVID reproduction was lower to partial lockdown area and higher to non-partial lockdown. So that data created a decision by me to create a partial lockdown for the whole province to reduce the speed of reproduction. This is example. The green one is before the partial lockdown. We reached the index of RT, reproduction number, of 3, meaning one person can infect 3 persons a day. Yeah, but now because of partial lockdown, the color of yellow, Bodebek, the color of grayish, Bandung Raya, and purple, light purple. Now our speed of reproduction is around 1, which is according to WHO, if we can keep the RT to 1 and below 1 for the next consecutive 14 days, then we can have a full new adaptation of economy. So this is a good news. Yeah, our partial lockdown decision was correct, and our whole province having a partial lockdown also. It was a biggest experiment to contain and control 50 million people, and this is the scientific result. Our speed is of virus reproduction is 1/3 from the initial one. So hopefully the next following week, if we can keep in the rate of 1 or below 1, then potentially economy can be reboot and recover as soon as possible. So that's a second value of leadership, is scientific leadership. The third value leadership was transparent. We try to be transparent. We publish data as it is. We created what we call the apps in Google Store and Apple Store also. called Picobar. People can check data, people can complain online, people can donate, people can register for volunteers, people can download data analytics per cities, per area for everybody to use, and people register for PCR or rapid testing also using. This is very, very helpful because all the complexity now reduced into one single door of organized by one apps. It is now nominated for World COVID Innovation in some by the Gov Insider, for example. So this is how we try to be transparent. And the fourth value of leadership was we try to be collaborative, yeah, like this webinar, because we don't think we can win fighting COVID alone. So we need all the chambers of commerce to support West Java. We need the scientists of all universities to support us. We try to ask people to be more empathy in this area, because as you know, the crisis, we have 3 stages. Stage number 1 is healthcare crisis. Healthcare number 2 is economic crisis, and healthcare number 3, crisis number 2 was social and political crisis. So we are at the economic crisis. We are hoping we don't have the what we call social and political crisis or unrest. So that's the collaborative value. And the last value, we exercise what we call innovative leadership. This is the slide to show you that Ainsley and Chris, we are very proud that all the equipment to fight COVID now is in West Java, ready to mass produce. We have manufacturing produce surgical masks. By the time people frantically try to buy and import it, we have factory in Bandung, in Bogor, in Cimahi. We can produce our own ventilator. We mobilize PT Pindad, used to produce military equipment, now produce ventilator. We produce a ventilator through PT Dirgantara. The engineers and the scientists of this airplane company now produce an affordable ventilators. So from 50,000 per unit imported ventilator, we can use this only for like $1,500 ventilators. And Biopharma can produce the PCR region now, will produce 100,000 PCR. And we have startups also producing the rapid test with twice as accurate as the Chinese product. Why? Because the Chinese rapid test product was the antibody rapid test, only checking the antibody level when you have a foreign object coming to your blood, but not necessarily locating the COVID. But our scientists in Pajajaran University now can produce this rapid test locating the protein of COVID. So this is very accurate, 80%. We'll produce 50,000 rapid tests next month. But my point is, with this innovative mobilization leadership, West Java is sufficient enough to have our own resources, less import. So maybe in the future we can help other province, and who knows, we can help other countries, because as you know, 60% of industry in West Java, in Indonesia, located in West Java. So that's basically 5 values on how every day we try to fight COVID. We try to be proactive, always scientific, always transparent, try to be innovative, and embrace what we call collaborative value. within these values, we have 3 strategies to fight COVID. Strategies number 1 is prevention strategy. Why? That's all we have, Ansley and Chris. We don't have much money like South Korea for 50 million. I have only 1% of money. So what we have is only social capital. So our defense system rely on what we call the prevention strategy, the defense. Yeah, this is where the PSBB or partial lockdown, social distancing, and so on and so on. Second, we are tracing and testing as many as possible. According to a study in South Korea, they found the complete map by testing 0.6% of its population, which is around 300,000. So we are trying to do the same, since we have the same population like South Korea. We try to aim 300,000 testing, but per today we can only test around 150,000. Hopefully the next coming weeks we can reach the index of 300,000 citizens to be tested to have the complete map of how to fight COVID. Yeah, that's the second strategy. We test by drive-through. West Java was the first province to do the drive-through testing. We now aggressively doing the testing in the wet market, in the terminal, stations, airports, and bad news is we found 1% of the sampling is COVID positive. That's why I don't really appreciate the travel relaxations implied by the central government, because it creates difficulties for us in the point of arrival to have testing for arrival people. As you know, the homecoming rituals is really the headache for us, because when we forbid people to do the homecoming, before the policy, we have many report imported case. Local people got infected by the traveler from homecoming rituals from Jakarta, for example. During the forbidden of homecoming, we don't find any reports of local people infected by traveler. So by the relaxation, I'm a bit worried, but we have to deal with it. Yeah, the ban of the returning to hometown or homecoming, or we call it mudik. Yeah, as you know, this week will end the Ramadan. Sunday will be the Idul Fitri. So this is a very critical week for us not to. So that's prevention. Second is tracing and testing, and the third strategy is increasing the capacity of our healthcare system. Ya, kembali ke 3 strategi dulu. The healthcare system. So basically 3 strategy: prevention, that's all we have. Testing and tracing, we still 50%, need to increase, and improvement health facilities. Now, after all this strategy, Ansley and Chris and all participants, I would like to bring a good news that this strategy works very well, but we don't want to be slowing down in this. Number 1, let's see the data. Coba mulai data-data. The data of back to the RT, yeah, back to the speed of COVID reproduction. By these 3 strategies, before partial lockdown, as you see, the data was index 3, now index 1. We try to keep this index 1 to up to the next 14 days. So this is a good news because of our strategy. Second is the number of hospital bed is now reduced. The patient treated is reduced. As you see this, the peak of number patient happened at the end of April, 430 patient, now reduced only 270 patients. So the curve is flattened according to our data in West Java. So I would like to thank you, the doctors, the healthcare workers, for fighting very hard in West Java. With total 105 hospitals now, the number treated patient is reduced, and only 30% of our hospital bed is used for isolation. So in West Java, no need to transform any building to become emergency hospital, because our own hospital is only used 30%, with the trend of number of treated patient is lower. Number of cases also, good news, is reduced, data harian. This is the data. As you see, the peak happened during before the partial lockdown, the green color area, that's the peak. Now, last month was around 40 cases a day. This month of May, we have found only 20 to 21 cases a day, yeah, average. So the yellow line. So this is a good news, yeah. Then after this, we are discussing what's next, because our partial lockdown will be ended the day after tomorrow around Wednesday. So we have 5 levels. We have 5 levels of, so Ansley and Chris, we are following your government's methodology. So this one, I'm copying the Boris Johnson's level of safety, but we make it local style, okay? We will have 5 levels of safety. The worst one, level 5, black color, it means uncontrollable. Yeah, so that's, but I don't think we have that situation. We have currently in the level 4, yeah, red color. It means is a heavy and difficult situations, yeah. Next, the following Wednesday, some of this level 4 will be lower to level 3, yellow status. In level 4, your activity only allow 30%. In level 3, yellow, your activity can increase to 60%. If you have the blue level or level 2, then your activity can go back to 100% with social distancing and health protocol. And the best one would be level 1 is a green color. The green color where everything go back to normal, and just be cautious on what you are doing, because I believe there is no guarantee COVID would be 0 unless the vaccine and the medicine is found. Ya, coba ke level tadi. This one. So this is one I adjusting from UK model. Udah itu aja dulu. Okay. So this is jangan digeser-geser dulu. Sorry about the slide. Kenapa bolak-balik? Itu yang tadi. Nah, itu. Udah, diam aja. Okay, so you see the next Wednesday, I will create a status, Ansley, to 5,300 villages and sub-district. Jadi ada 5.300 kelurahan dan desa. We will label this 5,300 villages and sub-district or kelurahan, which area label black, the worst one, which area need to have continue the partial lockdown, PSBB, which area can lower to yellow, blue, and green. This is and each of this color will have a guidelines how to do your new life in the new normal with the new adaptation. So this big news will be announced this week after all the data that I show you. We are doing a good progress. Yeah. Last point I would like to make is the economy. Coba ke ekonomi yang Unpad, Kang. The economy is basically, Ansley and Chris, everybody got hit, will be going down, but how low will you get affected? So this is the scenario that we have. This is very important for all the economic concerned people to have. Nah ini, coba ke yang tadi. This economy, the green one is our pre-COVID growth is around 5%. If we do nothing, then we will have the blue line, will be minus in this year, will recover 2021, but below 5%. It's very bad. Yeah. So I think with the economic stimulus, the leveling 5 level that I will announce this week, I can create a balance how to fight COVID with 3 strategies, 5 leadership value, but also maintaining the economy. So we try to have the orange line, Ansley, which is will be low up to maybe plus 1% at the worst, but will be jumping next year to maybe 9%. And suddenly it will reduce everything back to normal in the next 2 or 3 years to 5%. This is scientific prediction from Pajajaran University. So now how to survive during the second stage of crisis after healthcare crisis, which is economic crisis, we have to have a social safety net. Coba yang 94 juta. Surprisingly, I have to subsidy big time. This is a bad news. Before COVID, only 25% we subsidy, and now the sad story is we have to subsidy 63% of my people. So you can imagine now 2/3 of my people asking for social safety net money from the government. Before only 9 million, I have to subsidy now 38 million out of 50 million people I have to subsidy. So we are allocating all the money that we have in the government. So basically, Ansley, I stop all the projects, the government projects now. We're shifting all the budget to this. In total, I have to support 9.4 million household from the total 14 million household. So we try to survive until July. If July okay, then we go back to normal. But if July still COVID problem, then we have to discuss the emergency measure. Yeah. So the second way to survive the economy is the answer is I will relax the economy, Ansley, if you're already in the yellow status. Because in the yellow status, it means 60% of the activity is allowed to have existence. If you have a blue status, it means 100% with cautious, no congregations. Yeah, but if you are in the green, then economy 100% back to normal. But to answer your corporation investment, once you have the yellow status, you should be okay. Yeah, with the arrival of our testing capacity, I can test your workers, your your industrial estate to have a COVID-free environment using our testing capacity. So that's the good news. And according to the latest issues that we will publish, only 50% now in the red zone. The remaining 50% of West Java is already in yellow and blue. So we will try to fight more the red become yellow or blue. And last slide I would like to share is the economic package by the central government. The central government, according to our latest, will create a massive package, is around 400 trillion rupiah, yeah. 400 trillion rupiah already decided by Pak Jokowi, and it will, langsung ke gambar aja Kang. It will give a series of strategies. I will find quickly the slides. Yang 4, yang warna-warna itu, warna-warna paket. Nah ini, bukan yang ini, yang ada tulisan, angka. Nah ini, nah itu, maaf, yang tadi. Sorry, it a bit slower on the webinar. So this is basically the economic stimulus for the COVID. Number one, we will spend extra to fight COVID as soon as possible, 150 trillion. We will give money to the poor side of society affected by COVID, 110 trillion rupiah. We will have reduce the tax covered by the central government, around 70 trillion rupiah, and also the small medium enterprise tax. And lastly, number 4 is 150 million for economic recovery, which include the padat karya or human intensive projects, yeah, all over the area. Coba ke bawahnya lagi. Terus, this one is the manufacturing. There are 19 manufacturing sector that will benefit from our economic stimulus, and majority happen to be in West Java. So if your chambers of commerce members, for some reason within this 19 sector of manufacturing, you can apply for reducing the tax, reducing the payment timing, and so on from industri bahan kimia. I forgot in English, but basically you can read this one up to the footwear industry also. My take as a governor is I want to make sure that your employee is COVID-free. That's why I will do a progressive and aggressive testing in your investment area, for example, to make sure you are doing whatever you like, but making sure that there is no COVID around your working area. So I think to conclude, I have the last slide. I'm hoping we can work this and fight COVID together. Yeah. So because without the COVID control situation, economy activity also will be very difficult. So if you can help us in West Java, I'm offering 5 area. Yeah. Number 1, if you have any availability to support us in healthcare facilities, like ventilators or any medical equipment, more than happy and appreciate for your help. Or since we have only 50% capacity, if you have the PCR or swab test, can donate it to us, more than happy also. And if you have a social security, for example, Ridwan, give you some money to buy rice for your poor side of society. I'm very grateful also. Or supply chain of COVID product or research. Ridwan, I have a university scientist would like to use your data to help other option of solution. More than happy also, and I appreciate. By this, I conclude. This is very comprehensive explanation I ever presented to many groups. Yeah, so hopefully all of you have a clear position of West Java and would like to support us so we can go back to normality as soon as possible with the new normal. Yeah, thank you, Ansley and Chris. I give it back to you. Thank you.
Well, I would like to thank you very much for your time today. I wish you all the very best in your efforts to deal with this crisis. It sounds like you're making a lot of progress in West Java, and we'll continue to look forward to things improving there. I do hope it's not too long before I'm able to get back up to Bandung. We've got a few things we're supposed to be working on this month that have been delayed for a couple of months. And one final point I'd like to make is I would really like to thank you for your transparency. Someone once told me the truth is your best friend, and I think today you've been extremely transparent, and it's helped us, everyone listening, to really understand much more clearly what's going on and the path to potential easing of restrictions, etc. So that's very, very much appreciated and a good lesson for us all. I know you're very busy.
Thank you for having us.
It's my great pleasure. Thank you very much. Chris, thank you for putting this together, and thank you to everyone that's participated and listened in from all the other chambers. Thank you.
Thank you, hatur nuhun.